And welcome, everyone. It's delightful to be with you today. The title to this is Know Nothing, None. Interesting, because we're really trying to full question about supervision of peer support workers. You're at the SHARE Conference 2023. So again, welcome and continue in the chat. Here are our presenters. You will be hearing from all of us. Myself and my colleagues decided to do this as a roundtable because not only do we bring a wealth of experience to the topic of supervision, but we also wanted to have an opportunity to interact not only with each other, but with you, the audience, because we think that supervision is real important. It's a lot of discussion and play at various conferences, but there's so much to be said about supervision, and we're really looking forward to leading that conversation off today. Next slide, please. So we're asking you to participate in answering the three critical questions that really brought us to the title that you saw a little earlier. I'm just going to review them, and then we're going to have a poll that we are going to ask you to participate in. And the questions we're going to be asking you have been asked throughout the country. Many of us have had national experience training, and we've done research, and we have experience with how these questions have been answered up to today. And we want to continue that conversation with you, yet another audience. So the first question that I know personally as a national trainer, we ask people is, did you volunteer to be a supervisor? Did you volunteer to supervise a peer worker? The other question we're curious about is, and once you got that responsibility, were any other responsibilities removed from your plate, as we say, to allow you to have time for supervision? And the third question that has been added to our discussion about this topic is, and as a supervisor, what training in supervision and supervising peer support workers have you received? Next slide, please. So this is a poll question. The poll is going to pop up, I believe, somewhere, so that you can answer, did you volunteer to be a supervisor? And I'm not the poll person, so I believe there it is. So take a few minutes to answer the questions. Again, the first one is, did you volunteer to be a supervisor? The second is, were any other responsibilities removed to allow you to have time for supervision? And the third, again, is, what about that training in supporting and supervising peer support workers? How much training in supervising have you received? And although we have a fourth question in this poll that's not part of the three critical questions that we're going to be talking about primarily, we're also curious about whether or not people in the audience have had a chance to look at the NAPS guidelines having to do with peer support work and peer support supervision. I think people have answered. It's nice to see that we're experiencing a shift in some of the answers, kind of evenly divided between, did you volunteer to be a supervisor of a peer support worker, or did you not? And Moving on down. The most familiar answer is usually nothing. Thus, know nothing. And yes, none. So that is in line with what our experience as trainers and researchers have been. And so that's the conversation we want to have with you today, because frequently we find, as we talk about supervision and how to do supervision, that the elephant in the room has to do with these three questions. Next slide, please. I think the one after this. Yeah, we have to go through our poll questions again. One more. Okay. And Rita, I believe I'm going to hand this over to you to have us start off about talking about the unintended consequences.
Thanks so much, Joanne. And I was surprised at the poll. We had a lot more people who did volunteer to be supervisors than I would have thought. So that was really encouraging. So I'm Rita Cronice, and I'm not a supervisor, but I am a consumer of supervision, if you will. I've had some terrific supervisors through the years, but I want to focus on one experience in particular that I think directly relates to these three questions. At one point, I worked as a peer support specialist in the VA. My supervisor was a social worker by training, and she had her own very heavy caseload in addition to supervising three very rowdy peer specialists. And I'm sure that she was voluntold to supervise us, which way back in the day, the VA made those kinds of assignments. It was just really typical of the way things worked in the VA. And I recall from my supervisor a real lack of patience with those of us who were peer support staff. And in hindsight, I didn't realize it at the time, but it was probably because she was still carrying a full caseload of her own. And working with us took time away from her own, what she felt was, her biggest responsibility. So there was frequent friction around the things that she assumed we already knew, particularly about things like dual relationships and boundaries, even though none of the three of us had ever been trained as social workers. And on this other side, our supervisor had no idea how we had been trained in our peer specialist training. So I do remember how uncomfortable this particular supervisor was whenever we shared our personal experiences in recovery, whether it was with the veterans we were supporting or other staff within the VA. And in supervision sessions, one of the things that she frequently focused in on was not setting people up to fail by giving them false hope. That was always the mantra that she came up with for us. And the hierarchy was one in which we couldn't really question our supervisors, so there was never a lot of discussion about the reality of recovery and helping people to choose what it is they want to do and finding their own pathways to achieve it, or the boundaries that might be different between social workers and peer specialists, or really any real chance to learn from each other through co-reflection. But to be fair, this experience was back in 2007, and I was among the first 100 peer specialists that were hired into the VA, so it was still a learning curve for everybody. I do know that things have changed a great deal since then. I've known a number of peer specialists in the VA who just love their jobs and are doing great.
Where are you employed?
So anyway, I think it's really important to look at that because supervisors in any setting that are incorporating peer specialists for the same time are going to be wrestling with many of the same issues I think that we were wrestling with our supervisor in the VA. And to be open, there's just to be open with peer support in other disciplines. And really the biggest thing is to validate not only the wisdom of the lived experience of the peer specialist, but also for us as peer specialists to really validate the wisdom of the supervisors and what they're doing. I think there's, things that go both ways and really need to. So now I would just like to invite all of you in the audience to think about the three questions And in the chat, just maybe add one anecdote or something that you can think of that you could quickly add about the unintended consequences of either being directed or mandated to supervise if you were, or if you volunteered yourself and what that was like. Absolutely, because our poll showed we had, kind of a split decision there. So either way, what your experience was, or the experience of not having anything taken from your workload, or the lack of training that you might have received about supervising peer specialists. And while all of you are adding to the chat, I would like to invite my co-presenters to also respond to this question. What are the unintended consequences when these three questions are answered? No, nothing, none.
Thanks for that, Rita. I just want to pitch in a little bit from my own experience. And I'm so happy to see that there is that shift, because I too have been working in this arena for a long time. And since 2007 on, most frequently the answers were no, nothing, and none. And it's not unique to peer support workers. I mean, I do have to say that often in organizations, people get voluntold to be a supervisor, and frequently is based on them being, excellent practitioners, excellent workers, and, have a presentation that says to upper management or whoever gets to make that decision, you would make a great supervisor. And that kind of acknowledgement is very hard to turn down sometimes. The other thing we know is that most organizations in behavioral health are running on kind of shoestrings. This arena is not flush with, money for private jets and, conferences. I think I'm pretty accurate in saying that to all of you in the audience. So often, I know I've experienced it personally, you become a supervisor, and the expectation is that you're going to figure out how to do that. And what I've seen is many supervisees talking about the fact that they really don't get supervision. That, even if they have a scheduled supervision time, it doesn't happen because a crisis happens or the supervisor gets pulled in to some other meeting, etc. So, that's what I've witnessed as the unintended consequences. And I'd like to pass it on to one of my other co-presenters.
Good afternoon, everyone. I believe that's me, and I believe that I'm unmuted and visible. I think we're ready to move to the next slide. I hope I didn't jump the gun. Great. So I'm Jonathan Edwards, and I'm working among 4 really wonderful colleagues. We meet at least once a week. I won't go as far as saying we're enmeshed, but we do see each other a lot. So much to the point that when I was signing off with Rita yesterday, I said, I'll see you one day soon. And when I clicked the phone down, I said, oh, I'm seeing her tomorrow morning. So anyway, that's just to let you know that we have a common interest in this work, and we talk a lot about it, and we have a lot of experiences that we bring together and have an opportunity to share on. So I was asked to talk a little bit about how our supervisors identified, trained, and deployed. And I will not pretend that I have a formulaic response to this question, and that there's one way of doing it, but I will share a couple of visceral reactions that I have to this question. And the first one is that I believe that supervisors are often identified, trained, and deployed in a whirlwind, such that I'm not even certain that the 3 questions that are the focus of this presentation are even pondered. In fact, when Joanne first presented this to us, I said, oh, right. Those are important questions. I wanted to be a supervisor because I wanted upward mobility, and I wanted to, as they say, cut my teeth and build skills. And also my supervision experience really took off when I went to a hospital system to work. And so, I was one of those people, who would have said I volunteered, or let's just say I sought out advancement, which landed me in a supervisory position. But I will say, I think this question for me, it speaks to not just how supervisors are identified, trained, and deployed, but who we end up supervising. And I know that might sound really provocative and disparaging, but what comes to mind is an example of being at a conference in New York State about 15 years ago, and I was presenting on a panel. And afterwards, one of my colleagues ran up to me and said, "I want you to meet someone." And I won't describe the person because I believe in anonymity, but this person was brought to me and made a really wonderful impression. And I was told, "Oh, you really need to hire this person because you've never met anyone like them before." And so, long story short, they were hired. And this person has a lot of strengths. I believe in starting with the strengths, but there were also many a nightmare. And once I asked my colleague, I said, "Let me ask you a question. What sort of motivated you to bring this person to me?" And she said, "Well, I knew you could handle them and nobody else could." So in a sense, my experience of and my lens on supervision tends to be a little bit I was going to use the word pathologized. I've had some very negative supervision experiences, but yet it's become the foundation of a lot of my work. So there's an inherent tension there. And, I've seen supervisors identified, trained, and deployed many different ways, but I would probably leave the training out of it. Although me and my colleagues really work a lot on developing training, it's often the case that supervisors, particularly in the human services, do not receive training. Usually they're identified. That's a really nice word because I think it's more of being told, and not even voluntold, but just you're going to do this. It happens a lot when there's restructuring, when things are moving around, when one manager may get really overwhelmed and need to spill over some of their responsibilities to another person. And unfortunately, I don't have a really cheery story to share with you all about how to answer this question. But I would say that we really have the opportunity to change this paradigm. And I think we're doing that even as we present here. And I think that's one of the reasons that we're here. We do a lot of work in bringing together supervisors, both of peers and non-peers, holding focus groups, conducting research, developing curriculum, working with academic institutions, working with people who are actually on the ground doing the work to really try to learn what supervision is about and to try to some extent, manualize the practice, as well as, get a sense of what is good supervision at the end of the day. And unfortunately, and I'd really be interested in hearing some of your or seeing you put your responses in the chat to what your impressions are of how supervisors are identified, trained, and deployed. As you're doing that, I'll just add on to say, I think as I age, I tend to be more transparent and less diplomatic. And I'll say that with the peer support workforce of which I'm a part. And I used the word before, pathologized. I think when someone is not particularly work ready and they're thrust into the arena of the world of work, it's sort of like what I remember at a children's birthday party, the game hot potato. They get passed around, take this person because you could handle them. And in one sense, it feels flattering. In another sense, it feels a little bit sad that we regard coworkers as such, even when they come and they have some strengths yet to develop. And so I just kind of wanted to share that to say that I've seen people commodified and disparaged and their weaknesses focused on in the realm of supervision. So please put some comments into the chat. I'm seeing something about a certificate, but I'm not seeing much more beyond that. So how are supervisors identified, trained, and deployed? If you would just pop some of your responses in the chat, that would be great. So I'm not sure if Rita and Joanne gave out candy, but I'm not getting any answers. So I'm assuming that there might be something different going on. Or if somebody wants to just unmute and chime in, should I do my part now? Amy. Wow, Amy. I guess you're saying play that music and get him off the stage. Hurry. Yeah, Amy, why don't you jump in? And if somebody
No,
wants to
not at
circle
all. I
back
would
later.
never feel that way, but I figured while people are thinking and typing, I can kind of share a bit and then go back to what
Yeah.
folks
Well,
are.
now the answers are coming. So you did something to make this happen. So thank you. So Bonnie says, I think the problem is that most supervisors are not trained or deployed effectively. I would agree. David says experience as a lead CPS before supervisor. So it sounds like you had a career ladder. Congratulations. Sharon says, I run a number of support groups, and based on my success with that, I was thrust into a supervisor's role. It's a different skill set, I'll say. And Jana says, I'm sorry, I'm not a supervisor. Don't be sorry, Jana. Gita says, yes, Sharon, this is a common issue across employment domains. Great programmers get taken offline to do administrative work for which they are not qualified or trained. And I'll read the last one and then I'll pass it to Amy. Katrina says, supervising requires built-in leadership mixed with on-the-job experience. And I like to refer to supervision as that very delicate dance, striking the balance between being compassionate, understanding, being able to discern the differential needs of people without creating a double standard. And it's possible, but not many people are really going to sign up for that. Anyway, Amy, take it away.
Thank you, Jonathan. So I really appreciate, firstly, being invited by this group of colleagues to talk with you all and spend some time today thinking about and discussing the ways in which supervisors are identified, trained, and deployed. And much of what you all shared in the chat thus far has been my observation and experience as well. So I feel like I'm in really good company. I've been a supervisor. I am a supervisor. I'm also a project director, a trainer, and a consultant, and my areas of interest certainly include supervision. So the majority of that experience has been within nonprofit organizations that are community-based and are doing kind of a wide array of services, providing different types of elements of service to people residing in our communities that are either through peer-run organizations or organizations that employ and hopefully train peer workers and supervisors, although that's not always the case. And what I've noticed is that the majority of supervision that I've seen prior to training and prior to doing consultation has really been very administrative supervision, so that those folks who are in supervisory roles are doing a lot of supervision that's based on outcomes of the programs that they're supervising within. So looking at things like units of service, ensuring that documentation is complete, and imparting and kind of upholding agency policies and procedures. What I've also noticed a lot of is that there's the majority of supervisors that are considered licensed, qualified mental health practitioners, which doesn't always mean that the supervisor also has the experience of being in the role of a peer support worker or having the shared lived experience of a mental health or behavioral health condition. I wanted to go back just a moment to when Rita started asking you all to think about questions and put your responses in the chat, because I think something that came through loud and clear is that supervisors may not always understand the role of the peer support worker And other members, especially in an interdisciplinary team, may not understand or value the role of the peer support worker. You also indicated in the chat, which is part of what I was considering for this slide, that there is a certain added pressure upon us when we're responsible for supervising others. So the jobs we do are stressful in themselves, and then adding the responsibility and accountability of supervising the work of other people can feel like a real added demand, especially, as one person noted, if there's a history of trauma or a bad experience with authority, that can really arise and serve as a challenge or a barrier in supervision, as well as people's kind of vicarious trauma from working with individuals who are experiencing really heavy life circumstances in certain cases. The other thing I've observed about the identification, training, and deployment of supervisors is that the supervision is not always tailored to the peer worker role. And so going back to that idea that many supervisors are skilled in administrative types of supervision, they do a good job training others in the policies and the procedures, and they may even do an excellent job at what's traditionally been referred to as clinical supervision. But we think in our experiences that the ideal is supervisors would be deployed in positions and providing supervision that's based on the principles and the practices of the specific job description and the discipline of the worker. So just like you would supervise a social worker in the practices of social work, you should be supervising peer support workers in the principles of peer support and tailoring that supervision to their job description and what the expectations are clearly designated for that role. So I think that that's all that I had for my bit, and I'll turn it back to Jonathan if you want to wrap up the slide, Jonathan.
Can I just jump in a minute, Jonathan? Because both of you said things that reminded me of why this conversation is important. And Jonathan, you spoke about transparency, and Amy, you brought forward the fact that frequently there is a mismatch between the supervisor and the supervisee. If the supervisor's never been a peer support worker, it's almost not fair to them to try to figure out how to help someone do that job. But the other thing that I want to get out into the atmosphere is what I've run into frequently is that because peer support work is relatively new, yes, it's been around as a paid position for more than a decade. It was around way before then, as we all know, but people are still getting their feet under them in terms of how does this work. And what peers have told me is that not understanding this background, which is a lot of supervisors did not volunteer, they were voluntold. Many of them had nothing taken off their plate. And certainly when we started this journey, virtually none of them were getting training in what supervising a peer support worker might look like. And what I noticed, and I talked with my colleagues and peer support workers, is that many peer support workers understood that to mean there was something wrong with them. So when they had a scheduled supervisory appointment at 1 p.m. and they showed up eagerly to talk about what their work was and what the struggles were, and the supervisor never showed up, frequently they did what we all do, which is, oh my goodness, what did I do wrong? I must not be doing a good job. My supervisor doesn't like me. You know, we all have that tendency to personalize our perspective and our experiences in the world. And so without this broader understanding that supervisors frequently didn't volunteer, they were put in that position, and frequently they don't have room on their plate. we're bringing it forward and making it visible because we want people to think about, oh my goodness. So I've got to be transparent about that. I really need to tell my supervisee, you know, I'm happy to work with you. I have a full plate. There may be times when I'm eager to talk with you and I get pulled in 6 different directions. Let's figure out a backup plan for that. Let's figure out a contingency and work through that issue. And also, the other thing that I hear frequently when I'm training is my supervisor isn't a peer, doesn't know what I'm talking about, wants me to do non-peer related things. I'm not the medication police, et cetera, et cetera. So to understand that it's not uncommon for supervisors to not have done this job would help people, we hope, to move to that place of mutual learning, mutuality, and be open and curious and say things like, you know I've never done your job. I'm not a social worker. I guess you've never done my job. I'm eager to learn from you. Let's talk to each other so that I can understand where you're coming from and you can understand where I'm coming from. So just wanted to throw that out there for people to think about or respond to. And Jonathan, I'm sorry, I just needed to get that out there and said. Back
No,
to you.
thank you, Joanne. Thank you. And, now I'm going to tell on you to say that you did your dissertation on the experiences of peer support specialists supervised by non-peer supervisors. And I had the pleasure of being at your defense. And so it makes sense that you would want to share all the wisdom that you learned through your research. And I just want to also circle back to Amy and say, one of the things I picked up from what you were sharing is, and I don't know if you said this, but it's what I heard, is that sometimes people are put into supervisory positions because they have good management skills. They know how to take care of things. They know how to put out fires. They know how to manage people, but they may not understand the work. And they may have really, really good intentions also. So I've seen a lot of situations that are benign, or benign in the sense that, the supervisor or the authority figure is not out to hurt anyone or to do damage. But there is definitely a disconnect between, good management and, understanding of what the mission and the purpose of the work is. And I've seen, really well-paid, respected managers who knew nothing about the work they were supervising, but they were smart enough to get good people around them. And so I guess that's a strategy as well. But oftentimes we don't see it pan out like that. Some of us have worked in hospital systems where we see, I just learned that the peers in a big New York City hospital are now working under psychology. Before they were under social work. Before that, the director of creative arts therapy was trying to sabotage somebody else so he can get the peers under them. So, there's just a lot of, as I used the term before, commodified. And I think a commodity is something that's often objectified and traded. So I've seen that happen to peer workforces where it's like, let's, how would you like to supervise the peers? Or how about we put the peers under your division? So it sounds like really bad placement, placement as in moving, children around to foster homes without being thoughtful. So unfortunately, those connections come to mind for me. And I will then pass on to, I'm not sure who's next, but I'm going to flow out now.
I'm going to jump in quickly because I want to talk about, to give some hope. So I have been working in peer support supervision for about 11 years. And before that, I was a peer support worker. And now, although I'm a social worker, I maintain my peer support specialist certification in the state of New York. And the reason I tell you all this is because we're going to bring Rita in to talk about peer values. And one of the biggest peer values is mutuality. So I like to think of myself as a disruptive supervisor. I have group supervision. I'm the contact person for the whole public health system, but I jealously hang on to one program here. It's called the Peer Health Coach Program, and it's a boutique program where people are deployed to the various hospital facilities to give groups in the inpatient psychiatric units. This is hard work. And there's a great deal of compassion fatigue, vicarious trauma. And when we get into individual supervisions, I find we don't need to talk about people's diagnosis or whether their experience is due to their, I'm going to use air quotes, illness. I just want to give one example. I have someone who's very new to the work who it was uncovered in supervision that he had very negative feelings about himself because he's heavily tattooed, which he associates with gang membership and prison. And even though social workers are guided not to share too much lived experience, as a peer, I refused to operate that way. And I was able to tell Hyro, but I have several tattoos and I have not been involved in gangs nor have been in prison. Tattoos are your art and you should not feel ashamed. If they were a problem, we would not have hired you. And it just feels so good to share lived experience. It doesn't have to be lived experience of mental illness. You could say, I have a kitten, or I like classic rock music. And again, mutuality is the most important value for me, perhaps other than voluntary peer support. Rita, why don't you hop on and give me a little hand with this?
With voluntary peer support, I'm voluntary.
No, with the
Choice, you know, people
peer
make
support
choices. Yeah, people make, one of the most fundamental values is that people have choice and they're not forced into doing things. Another one of the values is that peers are open-minded and not judgmental and really don't take at face value. Suppose, you know, somebody is in their chart diagnosed as one thing. I really believe that peers should not be looking at people's charts before they get to know them, because that clouds their ability to be non-judgmental of the person. So there's lots of areas where being mutual and reciprocal, being change agents. So that's making sure that people that you educate and advocate for the things that go along with peer support. And I have another slide a little bit further on about the national practice guidelines, and I'll put a plug in there because our work group actually did work to add to those national practice guidelines what the role of the supervisor is in helping peers to be able to embody those values. So there's a whole area within those national practice guidelines that of all of us, Jonathan put his heart and soul into. We all contributed, but he really made a lot of contributions to that. And it's really a great resource. I know that in the poll, I think that it was like 25% knew about the practice guidelines and then 75% did not. I think there's a slide here in between though, because I think I'm jumping ahead over one area that we wanted to talk about. So I'm going to bring that up. And that's how peer values are understood, identified, and supported. So I am talking about this area. And here we have the national practice guidelines. I've sort of mentioned a few of the guidelines, but here is the website for the National Association of Peer Supporters, where the practice guidelines live. It's really a good practice to do things like potentially take one guideline at a time and use it in supervision, so that really both the supervisor and the peer specialist are really practicing each one of those values, core values, and the guidelines that go with them on a regular basis. So that's one area. Another big area is core competencies, and SAMHSA has the core competencies for peer specialists. So between those two areas, between the core competencies and the practice guidelines, and then any kind of ethical code of conduct that your state or your organization might have, between those three, that's a really good place to start with really understanding what are the practice guidelines and what are the core values of peer support. Any questions about that? And again, the poll was that. Let me see if I can pull that poll back up. Sharing the results. So we had 39% have reviewed the national practice guidelines and 61 of you have not. So if you haven't, I really encourage you to do that.
And it would, I think, important for Gita and Rita, if you don't mind, to continue the conversation about peer values, because one of the other things we all talk about, our group of colleagues, is peer drift, co-optation, and how easily that can happen unintended. When you have that peer support worker, there might be only one of you, maybe there are two of you. My experience is frequently large organizations can hire a group of peer support workers, but then they tend to assign them throughout the organization. So as a peer support worker, frequently you're alone. And there's a lot of pressure. You know, we're as a species, we're social people, we're group people. We like to get along with the group. If you're the peer support worker and the rest of your colleagues come from other professions that might not have lived experience or might not want to disclose lived experience, there is going to be pressure to join the mainstream, to be like everyone else. And as Rita started talking about, and I really want her and Gita to talk more about, those peer values that are not shared across all the professions that might be working together as a team.
Well, the first one, of course, that comes to mind is just the sharing of your lived experience, because most of the clinical professionals, the licensed practitioners, they're actually taught not to do that. And they're taught to keep sort of a professional distance so that there's not the attachment that goes with that. And it's very different for peers because we go in there heart open and we really do share our stories and we do encourage them to share their stories. It becomes a very mutual way of learning together. And that's just really one of the big differences between peer support and the other professions. And like I mentioned, my supervisor back at the VA, she was very uncomfortable with me sharing my story, very. And I think it's just because that was not how she was trained. And I hear the word oversharing quite often, where it's not really oversharing, it's really the sharing that peer specialists do. But it's seen as something that's not, and that is what is in alignment with the values of peer support, but it's not seen as what's right within many of the environments and cultural climates of many organizations. Gita, do you have more?
I have a couple of things. I was in a meeting this morning with, we have a quarterly forum for supervisors of peers in our substance use programs, and they're usually social workers or addiction counselors. And we were talking about documentation. And as I went through the documentation, I noticed that many of the peer support workers were not putting in their notes as an intervention, peer support worker, shared lived experience of whatever. Because this is the intervention. And the other thing they weren't doing was introducing themselves to participants and saying, hi, I'm Guillermo. I'm a peer support specialist. Do you know what that is? No. I'm someone with lived experience. I've been through what you're going through, and I want to talk to you about some things that have helped me begin and maintain my recovery. And so, yes, this is top of the line necessity. And these voluntold supervisors from clinical disciplines often are uncomfortable with that, but there is a thing called sitting with your discomfort, and this is what they will just have to do. I always tell this because I feel like I'm so lucky in one respect. Public health system is heavily unionized. So our peer support workers are in their own union, the social workers are in their own union, and the interns are in their own union. So if you ask a peer support worker to do something clinical, like a suicide assessment or a safety contract, or something non-clinical but ridiculous, like distribute snacks or make coffee, the peer support worker can grieve it with the union, and the social worker who may be looking on as the peer does that suicide assessment can grieve that out of title work with their union. So except for the lockdown during the pandemic in New York City, when it was all hands on deck and everybody was working out of title, I was calling the families of the deceased. It was just unreal. But Metropolitan Hospital asked me, could they deploy their peers to the Helping Healers Heal unit to provide supportive counseling? And that I thought was an incredible win for peer support workers here at H&H.
Great. Thank you, Geeta. So I'm going to move on to the what's a supervisor to do. I think this goes to Joanne.
It does. And thank you both for sharing those stories, because the more we share those kind of experiences, the more folks realize, oh, that's what happened to me, and I thought it was just me. And normalizing these kind of intersections where we haven't quite made the match that needs to be made between our profession as peer support workers and other professionals is really an important intersection, and needs to be talked about, and needs to be talked about in places where you can get support. So I'm going to talk about what's a supervisor to do, because as Jonathan mentioned, I was blessed with a gift of having to do a dissertation for my doctorate. And I will share with you the reason I got my doctorate is I wanted to have a chair at the table when these issues got discussed. And I wanted to have some of the clout behind it that a doctorate allegedly brings. I keep forgetting I have a doctorate, and Jonathan reminds me, and I'm very grateful to him for that. But so I did spend a lot of time with peer support workers who are being supervised by non-peer supervisors. And I will say to you, they love their supervisors. There are great supervisors out there. There's no question about that. Whether they were voluntold, whether they had anything taken off their plate, people who sign up to do this work to help other people have huge hearts. And it was on display as I talked to people across the country about, what was going on there. So when I talk about attitude adjustment, what I mean by that is the one skill that was really important for supervisors who weren't peers, who got voluntold, who were in a position to manage something that they'd never been asked to manage before, is when their attitude got internally adjusted from, oh my God, I don't know what to do, to, you know what? I'm open to learning. I'm curious. I'm okay with this. To respect and to be curious about peer support work really made all the difference. And that's easy for some people to do, maybe not so easy for other people to do. I will share with you that folks who felt they had to know that it was their job as a supervisor to figure this out ended up micromanaging in ways that peer support workers did not find helpful, because the non-peer professional might not have known what the job was, but was desperately trying to do a good job and didn't work out so well. So that openness of attitude, that public facing, this is great, I got your back, I know what you can do if I just let you, if I just get out of the way. That's the attitude adjustment that we're talking about. And modeling transparency, being that person on the team who can manage our own anxiety. I mean, that's really what gets in the way, right? You're a supervisor, you feel responsible for everything, in control of nothing. When you do your deep breathing and say, look, I'm trying to understand this. And when you share with your colleagues, we all have a lot to learn from this new member of our team, from this person who does something slightly different from what we do. Modeling that transparency is not only a pure value, but it really goes a long way to helping the entire organization and the entire team take that next step. And it goes along with what I talked about earlier, mutual learning. That's how we all learn. We learn from one another. And to be open about that helps. Many of us who have gotten academic credentials can frequently feel like, I'm supposed to know all this. I learned it, I remember it, I don't know what to do with it, but I'm supposed to be an expert now. I'm supposed to know what I'm doing. The reality is we all learn as we go along. Experience is the greatest teacher. Back in the day, even before my time, when there's apprenticeships, that was the expected way to learn. You weren't sent to a school to read a book. You were paired with someone who was doing the job that you wanted to learn. And that's how you learned it. And we've kind of gotten away from that expectation and put a burden on all of us that we're supposed to know what we're doing at all times. Never going to happen. The longer you live, the less you know. Take it from me. But the other thing that I want to share with you, if your answers to our 3 critical questions were no, nothing, and none, is build a support network. If you're a supervisor, you need a network. You need other supervisors to talk with and share with and get ideas from. If you're a peer support worker, you particularly need a network so that you have other peers who are doing your same kind of work that you can talk to and go to and say, "Oi, I just was talking with someone and this came up and I've never experienced that before and I don't know if I handled it the way I could have, should have. What do you think?" Et cetera, et cetera. So I want to engage my colleagues back into this discussion because I know all of us have had this experience of trying to figure out as a supervisor, what do you do? And those of you who are in the audience, we really encourage you to put in the chat some of these experiences that you've had. So the more we share, the more transparent we are, I think is a blessing to the whole community. So I'm going to invite my colleagues back in, if you will. Cats got their tongue.
Sorry about that, Joanne. I was talking away on mute.
And been there, done that.
I wanted to just take a moment and kind of highlight some of those important points that came up in your last part and then previous comments in the chat, as well as our colleagues. It really sounded to me like there were at least 3 or 4 suggestions made that we'll probably get to in another couple slides, but I didn't want to lose them. So this idea of co-reflection for peer supervisors, being able to talk with one another and kind of bounce ideas off of each other. It can be a lonely experience if you're doing this work and you don't have your own supervision. So finding opportunities to connect with other supervisors might be helpful. We also heard people talking about linking peer support workers to one another. So especially if you're the only peer support worker in your team or your organization even, that could be isolating. We did mention supervision based on the job description, so being sure that that's very clear and the expectations are understood. And then getting training in peer principles and values if you are a supervisor who hasn't been a peer support worker yourself. So hope that's helpful, Joanne. I just wanted to share my notes.
Thank you, Amy. And if we go to the next slide, I think that is kind of where we're heading to begin to wind down this presentation. You know, what are the pathways? What are the remedies? We suspect that you and the audience have intersected with a variety of experiences, either as a supervisor or peer support worker. We encourage you to either raise your hand or particularly put in the chat, you know, what have you discovered that has helped you get good supervision, the supervision you've always wanted? What's helped you as a supervisor be that person that you want to be as a supervisor? And Amy, I'm going to hand it back to you to kind of moderate this, if you don't mind.
Yeah, I'd love to. So I shared a couple of the ideas that came through in the chat or in the discussion, and we're really interested in hearing more about what are those remedies and pathways to help support not only the supervisor, but also the person who's being supervised, because ultimately the goal is to ensure that the person who's receiving supervision has opportunities for professional development, potential career advancement, and that they're providing support in a way that benefits the people who are seeking it. So supervision is multi-layered and multi-dimensional. And so if you were a person receiving supervision, we'd love to hear what were some of the remedies to know nothing, none. And if you're a supervisor, what were some of the ways in which you were able to kind of bolster yourself, perhaps, in order to do the important work you're doing? And any of our presenters can also jump in as well. So Jerry, thank you for sharing. What's helped Jerry is being transparent with the supervisor. That's wonderful. Identifying some of the areas in which there's a challenge or a barrier or a struggle being a supervisor, and then seeking out the training and guidance to become more proficient. That's wonderful. You're kind of hitting all of the important parts that we're discussing. Jana says, need to give the supervisor a break and ask more questions about how to support one another. And that's fantastic, Jana. I think one of the things that we've practiced and has been helpful to us in the past is doing things like, you know, collaborative agenda setting, ensuring that, you know, both individuals in the supervision relationship have the opportunity to describe what's most important to them, and keep kind of track of things that may not get attended to immediately so they don't fall off the plate. These are great comments, Katrina, using the review tool, allowing the peer employee opportunities to set the tone. So a really objective measure of performance is the fair way to help evaluate people versus some ambiguous or subjective measure, or it's done so infrequently that the person is blindsided. Sharon says seeking out educational opportunities like today. Thanks for coming, Sharon. Rita, encouraging group supervision with peers in the lead. Gita, supervisee brings the agenda. Love that. And learning what not to do by having a good supervisor in the past is great. Jonathan, did you want to take over and kind of round out the strategies part?
No, I actually was more in listening mode and I didn't put in anything. So just for the sake of time, I will forfeit that. Thank
Okay.
you.
All right.
I
Shane.
see Shane has a
Yeah,
hand
Shane.
up.
Thanks, Gita. Go ahead, Shane. You can unmute whenever you're ready.
Hi, thank you so much. I just wanted to share that I love this whole thing. I supervise a group of folks that I am not a peer with them. I did not experience the trauma that they went through. But I have supervised people for many, many years. And so this experience has been very different. I've had to really grow and learn. I've had to, become more empathetic. I've had to, and I think the way I think of it is I'm not really the supervisor. I'm a team member, right? We're all in this together. We're working on a project together. I may have some resources that are helpful for folks when they need it. They look to me as, a member of the team, but also someone who has a bit more experience in the administration of a project that they don't have. And so that's the piece that I bring to the team, is the administrative piece. And so I just think of myself as a resource person. And yes, once in a while, I do have to say, like, you didn't do something, or you are late, or, I do have to do that every once in a while. But really, I feel like my job is just to be a good team member and to offer resources when people need it, or when I see that they're struggling with something. But I really, like a lot of the comments that are happening right now, I really look to them to come to me. We're all adults, right? We're all adults and we have life experience. And if you need something, I try to leave the door wide open to come and talk. Let's talk about it. Let's see what do you need? What do you think? What do you have already at your fingertips? And how can I help? That's kind of how I look at it.
Thank you, Shane. Okay, thank you so much. And I'll turn it back over to Jonathan.
Thank you, Amy. So we wanted to share with you a new and relevant resource. It's several months new. I once again had the privilege of co-editing this collection with Rita Cronice, Gita Enders, and Dr. Joanne Forbes, all of whom are here. And so we are working together on a workforce and supervision committee. We've been meeting every Monday morning for several years. And after doing a 6 months learning collaborative that was funded by one of our sponsors in the community, we thought about what the next project would be. What we did was we did outreach to all of the presenters from the past 5 years of conference presentations at the National Association of Peer Specialists. And what we did was we curated all the submissions. We wanted to create narratives from workshop content with chapter overviews that were written by all of us to really offer a resource that brings together work by peer specialists and supervisors for peer specialists and supervisors. And so it aptly has the title, What It Takes, Wisdom from Peer Support Specialists and Supervisors. I'm really proud that we backed away from a very prestigious academic publisher who actually wanted us to sort of hand over the rights to our content and also price the book at a point that would have been unaffordable by many of our stakeholders. And so we chose to self-publish through Amazon and to have this as a fundraiser for NAPS. And so I think we're doing pretty well. You can order the book through Amazon. Was looking for a QR code, but if you just go on Amazon and type in What It Takes, this will come up. The book is $26.95. It's certainly well worth it. In pages alone, this is about 460 pages. And as I said, it has many presentations that are summarized and has actionable guidance that I think would be helpful to many, if not all of you. And the Kindle edition is $12.99. But if you're anything like us, you'll probably want to have the hard copy because this actually does look nice on a coffee table. Skeeter, I think you're up.
Next slide. So now we only have a couple of minutes, but I want to thank everybody for joining us. Remarkable turnout. We love to address supervision of peer support workers. And so now is the time, if there are any questions, comments, you can unmute or drop them in the chat. We would love to turn the rest of this time over to you.
Hello,
Hello, Joseph.
how you doing, folks? My life has not been easy. I've gone through a lot of situations during my life. It's like it's taught me a lot. I've been through operations and near-death situations in my life. I study and read off of books from the library and online courses. I also volunteer. I'm a peer connector now in a recovery cafe out here in San Jose, California. I work along with Tanya Brista, who's a supervisor and teaches the classes in there for us to become certified to become workers. So now I work and I get paid to learn and watch and learn and read and study. It's challenging, but I've also been looking at opportunities to go to college out here at Evergreen, maybe City College or De Anza in the future. So I've been encouraged to do that. I've been straightening out some of my bills so I can get some Pell grants and some financial situation straightened out to go to college in the future.
Well, this
So,
is, oh, I'm sorry.
Go ahead.
No, I just want to say this is a wonderful story. I read some of your pieces in the chat, and peer support is, Jonathan is clapping, peer support can be such an elevating place to be. And we always talk about professional development and personal development, and you are the embodiment of that. I think this is very exciting.
Yes, I lived in tents and back of vehicles out here in San Jose. San Jose has been some of my best years of seeing the homeless out here. I've seen kids thrown out in the streets that their parents are irresponsible and not taking the responsibility of being their payees. And they have no idea how to go collect their checks or how to get on SSI or anything. And it's like, we just had a town hall meeting yesterday down there at Recovery Cafe, and we talked a lot, and I shared a lot of information with that town meeting too. So a lot of the people were overwhelmed at what I had to say. So this county out here is going to become in 2025. It's be civil amendment that the family courts are going to start taking care of and taking situations and answers filed by 2025. So that's amazing right now. So we're looking at that to become an effect in 2025.
This is great and very forward-reaching. Thank you so much. I think we're out of time. It's been wonderful spending time with you. Our contact information is on the screen, and you can, Jason, Robeson, and Brian know how to
I brought
outreach
down
out.
a few of your names, believe it. So I get links all the time from Tanya, and I'll be coming back into these chats.
And thank you, everyone. Have a great rest of the day.